Welcome to a new segment for the BioAnth News Network called Peruse the News, where we will explore in more detail a topic that sparked debate on the BioAnth News Facebook group.
A few weeks ago, two articles received considerable attention on the site. An essay titled, "The Husband Stitch Isn't Just a Horrifying Childbirth Myth," and "The Female Price of Male Pleasure," both dealt with aspects of female pleasure during sexual intercourse.
If you haven't heard of the husband stitch, you are not alone. One Sir James McKenna, a biological anthropology expert on mothers and babies, said,
Well, Sue, I really can't believe it. I mean, that is perhaps one of the most horrible things I've really heard in a long time. And that guy should have his license taken away. Furthermore, that husband should have every right to give him a good kick in the ass, to say the least. I mean, I can't believe it that would occur in today's day and age. It's grotesque.
The husband stitch is a painful procedure in which a woman's vagina is stitched up tighter than necessary after delivery, as the result of either a vaginal tear or an episiotomy.
An episiotomy is the intentional cutting of a woman's perineum during birth in order to facilitate smoother delivery and to prevent tearing. This usually consists of a 1 to 3 inch incision. The resulting husband stitch is an all too common procedure that has unfortunately negatively impacted women for decades.
Adding an extra stitch or two supposedly increases a man's pleasure during intercourse, creating a tighter vaginal opening. However, many women describe increased pain as a result. This is of particular concern because the husband stitch is often added by the surgeon without the woman's knowledge.
So, why is intervention often required after childbirth? Because some vaginal and/or perineal tearing during delivery is expected. An episiotomy is often performed in order to prevent severe tears from occurring, on the assumption that a clean cut will heal more quickly than a tear. A survey by Childbirth Connection found that in 6 out of 10 births in the U.S., an episiotomy is performed without the woman's consent.
Ironically, a large 2005 study by Hartmann and co-workers found that episiotomies not only failed to improve recovery times or pain after birth, but in fact increased the likelihood of deeper tears and pelvic floor problems for subsequent births. A later study by Ejegård in 2008 found that following an episiotomy, women generally experience more pain during intercourse than those who did not receive the treatment.
Also ironic is the fact that 3rd and 4th degree vaginal tears during delivery, the kind of damage for which episiotomies are supposed to be used, are very rare, occurring in only 4% of women.
It is worth noting, however, that these are pretty severe. 3rd degree tears involve the ripping of the vaginal tissue, the perineal skin, and perineal muscles that extend to the anal sphincter. 4th degree tears go through the anal sphincter and into the tissues and muscles underneath.
Perineal tears are common if a baby is large, delivered facing up, or, and this is key, if you have had an episiotomy during a past delivery.
In these cases, the resulting episiotomy incision mimics a 3rd or 4th degree tear, preemptively causing the wound in a controlled manner. This is why the episiotomy is touted as necessary or responsible by some physicians. However, the full procedure should be considered more cautiously. As we mentioned before, only 4% of women experience 3rd or 4th degree tears naturally, and the use of an episiotomy drastically increases the chance of high-degree tears in later births.
In the process of suturing following an episiotomy or tear, how well the stitches are administered can have major consequences on a woman's pain during sex later on.
There are multiple methods and materials possible to use for the suturing, and the choice of which is used has potential to influence the amount of pain a woman may experience. A general rule of thumb, more sutures and more layers involved means more pain during healing and during later intercourse.
While this stitching procedure is often considered necessary in the case of severe tears and in the event of an episiotomy, the husband stitch extends beyond the stitching of the tear or cut with the inclusion of an additional stitch in order to tighten up the vagina and restore it to its pre-delivery condition.
The husband stitch is given under the guise that it provides several advantages. Namely, that the procedure will aid in the healing of the perineum by preventing further tearing, will prevent incontinence, and most commonly will improve a couple's pleasure during intercourse by creating a tighter vagina.
The latter so-called advantage is completely unfounded and reflects a general lack in understanding of human female anatomy. The vagina is a muscle that expands during birth and sexual intercourse. This muscle does not loosen over time in the way that society perceives.
So we must ask ourselves, are the proposed benefits true? Are there advantages to this procedure? After all, procedures that may facilitate faster postpartum healing and benefit overall women's health should certainly be considered before denouncing the entire practice.
The husband stitch was given its name by Sheila Kitzinger in her 1994 book, The Year After Childbirth, Surviving and Enjoying the First Year of Motherhood. What exactly was she describing? A procedure to preserve the size and shape of the vagina, either to enhance a male's pleasure in intercourse or to increase the frequency of female orgasm.
However, this extra stitch may actually make intercourse more painful for women. A 2005 systematic review published in the Journal of the American Medical Association revealed that episiotomies did not help with incontinence or pelvic floor relaxation, and some women reported more painful sex as a result of the procedure.
Furthermore, the greater issue of the husband stitch being treated as a bonus treatment after birth, without discussion or consent with the woman, is a violation of the woman's right to make decisions about her body. A woman choosing to receive a vaginoplasty is one thing. Having one done without her knowledge and consent is quite another.
TheWeek.com recently published The Female Price of Male Pleasure, where various aspects of female enjoyment of sex were reported. Interestingly, a 2012 survey of sexual health behavior by Hartmann and coworkers at Indiana University found that 30% of women reported pain during vaginal intercourse and 72% during anal intercourse.
The husband stitch is only one of the features that might explain this pattern. Typically, sexual education tends to focus primarily on information regarding sexually transmitted infections and pregnancy, often inciting fear. The female orgasm is not spoken about. However, the male orgasm often is, as it is considered a vital part in conception.
Bad sex itself is defined differently for men and women. As Hartmann explains, for a man, bad sex is lack of orgasm or lack of pleasure. For women, bad sex is actually the experience of pain and extreme discomfort. There are fundamentally different scales of how sex is experienced.
Furthermore, there is significantly less research on female pain during sex than erectile dysfunction. A focus on the male experience is deeply rooted in our culture, so much so that a survey by ABC News did not even consider a woman's pain as an option on their survey about why women fake orgasms.
Thus, sexual encounters often revolve around male pleasure, while female pain and discomfort are overlooked. Conversations about female pleasure are often considered taboo, and the resultant lack of frank discussion of the topic leads to further misconceptions about female sexual pleasure, pain, and dysfunction.
Women suffering from female sexual dysfunction is often misunderstood, under-discussed, and associated with females simply being uptight and needing to relax, even in the medical community. This dismissal is part of a portrayal of women just being naturally tough. She will clench her teeth and go through sex despite pain.
It's clear that conversations about the husband stitch and other aspects of female sexual pain are important components of dialogue between men and women about sex in general.
I hope that our first segment of Peruse the News has provided more information of use on this topic. It is imperative that these types of conversations take place in order to foster a deeper understanding of the female experience before, during, and after birth regarding issues of sexuality and pleasure.
If you are interested in learning more about this topic or want to check out some of the sources we used, look in the About section below.
Be sure to tune in next time when we discuss the biopolitics of blood.